Thank you for joining us on your lunch hour. And it's my pleasure to welcome you to CPHA's Fostering Collaboration for Health Equity webinar, an update from CPHA's Health Equity Coalition. And so today we have multiple folks from the Health Equity Coalition here to help walk us through what the coalition has been up to over the past year. First, we'll have Jason Vitello, who's the Director of Health Equity at CPHA, talk about the importance of collaboration and partnership and how this really got started. After that, Jason will be handing it over to each of our work group leads. So we'll start off today with David Navas, who's the lead for the Organizational Infrastructure Work Group, followed by Lynn Coves, who's in charge of professional development and education. And lastly, but not least, we have Sedona Allen, who will talk about community engagement and the work that that group has done. So I will go ahead and pass off the torch to Jason to share a little bit more about the efforts thus far.
Thank you. Can everyone hear me?
Yes, we can hear you. Thank you.
Great. Sorry, I came and could not secure the computer I usually use and ended up in a room with a computer without a camera or audio capacity, apparently. So sorry, I'm coming through via phone today. But yes, I'm Jason Vitello. I'm the Director of Health Equity for CPHA and the Chair of our Health Equity Coalition. Our coalition is a very dynamic and diverse group of community leaders and cross-sector professionals. Many thanks to all of them for making this what it is. I also want to give a shout out to Brian Turner and Suzuho Shimasaki, two past presidents who were really instrumental in setting this whole thing off. I also want to thank a very supportive CPHA board of directors, including current president and president-elect Cerise Hunt and Kimberly Boyd, for making all of our work possible. I believe that very often the advancement of health equity is thwarted by leadership at the executive level within organizations and systems, but our leadership has been very supportive of these efforts from day one. All right, so starting off, why coalitions? First of all, I should note that we weren't always a coalition. We started off as a committee, but I believe that the coalition model was a more accurate representation of the work that we were doing. Plus, coalition just sounds cooler than committee. But everyone knows that Colorado has experienced significant growth in recent years. We've had new developments and investments, a lot of jobs, people flooding in by the thousands every month and have been for years. But we also know that it's not all blue skies and ski slopes for all of our Colorado residents. And there are others who are not sharing in the prosperity. They are being displaced and left behind. These are people who are unable to even meet their basic needs. We have high rates of homelessness and incarceration, people experiencing the diseases of despair, suicide, substance use, addiction, and overdose deaths. And these are people who have nothing inherently wrong with them, people who are simply reacting to difficult circumstances, adverse conditions, or trauma, which are largely perpetuated by inequitable systems. And in this way, Colorado is really a microcosm of America itself, where affluence and abundance in one area directly corresponds to marginalization and destitution in another. We often say the system is broken. You can go to the next slide. But it isn't broken. The system is in fact well-funded and working just fine. Entities with entrenched power don't want to see these systems fooled with at all. And I'm talking about a big pharmaceutical industry that does not want us to shift from a whole person, or rather from a disease-based to a whole person prevention model of health, or oil and automotive industries that don't want us to construct walkable communities or find alternate fuel sources. We have food companies that hire chemists to put additives into non-nutritious food to make it more addictive. Tobacco companies that want you to keep smoking and your kids to start smoking, and I could go on and on and on. And our work in community organizations, public health departments, and healthcare systems is truly critical. And we do enhance the lives of individuals and families in very material and meaningful ways. But I think a crucial question we must ask ourselves is, are we perpetuating oppression further by helping to maintain the status quo? Or are we challenging the status quo itself? And if so, do we have the power to be effective in this challenge? Next slide, please. Power, as defined by Martin Luther King, is simply the ability to achieve purpose. It is not inherently good or evil. He also said that it is required to bring about the social, political, or economic changes that we seek. He also said that it is precisely the collision of the moral power with powerless morality which constitutes the major crisis of our times. Next slide, please. And this is a conflict that is still very much in place. So why coalition? Simply put, power, collective power. A well-organized coalition has more power, can be more effective, and have more influence and a bigger impact than an organization or an individual operating alone. And it's not only about increased power in relation to opposition, but coalition work can strengthen members internally. It can improve one's effectiveness and help one to emerge in their own leadership. Next slide. There are other coalition benefits. I won't go into too much detail about all of these, but increased access to resources, enhanced legitimacy. A coalition of individuals and organizations in a unified front can both be attractive to potential allies, as well as strike an imposing and formidable force to be taken seriously by the opposition. Improved overall community organization and working relationships. A friend and mentor and a colleague of mine, Kelly Teeter, often says that Denver in particular is resource rich and coordination poor. Coalitions provide a platform for working outside of the status quo through coordinated and strategic efforts. And then finally, coalition work enhances collaborative bonds across racial, socioeconomic, gender, age, neighborhood, and other divides. And this isn't just important as far as community impacts, but I feel that it's good for us as well. And I operate from a collective liberation framework, and I don't believe that we will make manifest the societal transformations that we wish to see without unity across struggles. Wheeler Watson, the Australian artist and activist, really framed up collective liberation nicely in her quote, "If you have come to help me, you are wasting your time, but if you have come because your liberation is bound up with mine, then let us work together." And coalitions provide the opportunity for that work. Next slide, please. There are potential coalition challenges that I'm not going to get into, but they include lack of familiarity with the group decision-making process, disagreement with the coalition position, and turfism. But these and other challenges are addressed in two resources provided by the Prevention Institute. One is detention of turf and developing effective coalitions and 8-step guides. I also forgot to mention that last year during Public Health in the Rockies, we provided the opportunity for attendees to vote on areas of interest related to health equity that they would like to see in future webinars, as well as potential future topics at Public Health in the Rockies and culture of data, and how to foster strategic partnerships and collaborative work was the #1 voted on topic. And that's why we are doing this today. And I'm also hoping to equip you with some resources to help folks in other sectors that might be interested in doing coalition work as well. I recently presented at the APHA meeting a couple of weeks ago in San Diego on Colorado's efforts in that regard. Next slide. So also the challenges, the aforementioned challenges can be avoided altogether or mitigated through a high quality process, which we may not always pay attention to given the fact that a lot of our work and funding is outcome driven. Our Health Equity Coalition is not funded yet. And one of the few benefits of being unfunded is that we have been able to engage in a very inclusive, relational, and intentional, albeit very gradual process of development, a process which was in large part informed and guided by the Civic Canopy's community learning model. For those that don't know, the Civic Canopy is a fantastic community-based nonprofit in Denver, which connects organizations and diverse groups of people seeking change in their communities and equips them with the tools to be more impactful, such as the community learning model. It's a synthesis of research on effective teams and collaboratives, which demonstrates the correlation between the quality of process as well as the quality of population outcomes. It's really about continuous improvement and ultimately fostering a culture of collaboration. Next slide. And I don't know why that should be CLM, not CLC. But basically the CLM posits that a high quality process leads to better commitment from the participants, enhanced cooperation, and ultimately greater effectiveness. Next slide. The characteristics of a high quality process include fairness, equality, authenticity, and the last two, which I'll talk about. First, inclusion. So we understood from the beginning that to actually do health equity, to achieve health equity, requires engagement from beyond public health professionals and the usual suspects. We need them too, but we also need others that are not within the sectors we typically operate in. As a result, we have a very awesome group of individuals from criminal justice reform, academia, research, family and community leaders, housing, mental health, healthcare advocacy, and youth leaders. It was also important for us to make sure that people could join the coalition who were not CPHA members. We encourage membership, but it is not a requirement for membership of the coalition. So while inclusivity increases the likelihood of conflict and makes the process more complex, it also increases creativity, support for solutions, and provides legitimacy for our interventions. Next slide. And finally, goal orientation. There's a book called When Teams Work Best, in which 6,000 team members and leaders from aeronautics, athletics, business, healthcare, and beyond were interviewed, and there's a consensus that the single most important determinant of a team's success is a clear and elevating goal. There is a story that I like. There's a man who's walking along, and he comes upon a gentleman who's working pretty hard, and he says, "What are you doing?" The man wipes his brow. He says, "I'm laying bricks." The individual goes further along and sees a second guy, and he asks him, "What are you doing?" And he says, "I'm building a wall." And he goes a bit further down and sees the third man and asks him, "What are you doing?" And the man smiles and he looks up at the sky and he says, "I am building a cathedral." Next slide. So for the past year, a little more than a year, the Health Equity Coalition has been actively engaged in the process of building a cathedral. And that vision or that cathedral is that all Coloradans will have the opportunities essential to attaining their highest level of health. There's not a lot of words in that, but it is a robust vision. And our mission is that we will advance health equity and justice in Colorado through education, community engagement, advocacy, coordinated efforts, leadership development, and innovative cross-sector solutions. Next slide. These are our values. I was told that we have too many values. That's probably true, but I wanted to make sure in the spirit of inclusion that everyone's contribution was represented here. And I think they're all apt and relevant and important for the work that we're doing. Next. And one of our meetings, we collected this from our participants, and this really demonstrates the skills, the strengths, and the knowledge of the people in the room. Again, we have amazing people at the table, and we're always looking for more. Next. So actions. From the very beginning, everyone who came to the table really had one mantra. We don't want to just learn about health equity. We don't want to just talk about health equity. We want to do health equity. So we knew from the beginning that we would be an action-oriented group. And per our bylaws, we have 3 sections which loosely align with the triple aim of health equity, but organizational infrastructure, internal professional development, and community outreach and engagement. And at this point, I'm going to turn it over to my brilliant work group leads to say more about the work in each specific group. Thank you.
Hi there. So I'm David. I'm the chair for the organizational infrastructure work group. And like Jason said, after the CPHA determined that this was going to be one of the focus of the coalition, the coalition itself created a charter that defined the activities that we were going to be aimed at achieving. And so as you can see, those include a lot of cross collaboration and a lot of influencing the work that happens at the Colorado Public Health Association. And so the first is providing some organizational guidance to the association across the board. So from the board of directors all the way across all their individual committees. Actually building some of those bridges and relationships to cross collaborate with the coalition and the work that those individual committees are accomplishing. Assisting in the recruitment of members and the board with the focus on diversity, assisting in the planning of conferences, particularly the Public Health in the Rockies conference, and partnering with the policy committee to assess health equity impact of policies and promote legislation which advances equity. And we can go forward one. And so we took all these activities and we can go forward another one. And the first thing that we did was take those activities and put them into a logic model. And so we really dug deep and tried to define what our year's work is going to look like. And so this year we took a lot of time and sort of defining those activities. And we can go forward another one. And really, like I said, defining not only based on the charter, but also on the annual health equity plan, which was determined by the coalition, and sort of the goals and priorities to really achieving outcomes focused work around organizational infrastructure. And that also included formalizing some of the policies and procedures that the Health Equity Coalition was going to take on. And we can go forward another one. Okay, and so what we've accomplished so far is reviewing some of those goals, the mission, the vision that was defined by the charter, and determining some of the work that we're going to be doing moving on forward. We've continued to develop some of the coalition infrastructure through some of the logistics and preliminary budget and financial goals that the coalition will have. And moving on forward, we plan on taking that logic model and really plugging in those values that Jason showed, and sort of narrowing down our work a little bit more and streamlining it a little bit more to be the most efficient possible. And we'll be prioritizing some of those actions, particularly around representation of the coalition in some of those committees, which we've already started doing. We've already attended sort of the policy committees meetings as they prepare themselves to go into the legislative section for next year, and trying to form that relationship as to how we can plug in a health equity lens into how they address the legislative agenda that the CPHA organization has as a whole. And we can go forward another one. And so as we continue to increase our work and sort of dig deep into the activities that we've been defined or we've been assigned to achieving. Obviously, we're always looking for a little bit more capacity, and we're very much an action-oriented team and looking for action-oriented people to join us. And with that said, I'll pass it forward to Lynn from the Professional Development and Education Work Group.
Awesome. Thank you, David. So my name is Lynn Coves, and I am a lead for the Professional Development and Education Work Group. And so we have basically 4 main areas of focus currently. One of them is hosting monthly health equity webinars, such as this one. We also have a hand in helping coordinate some CPHA Connect events, which are in-person events. Additionally, we are working to create a web-based platform for education and dissemination of resources and best practices. Namely, we are looking to evolve the health equity page of the CPHA website to be a dynamic resource that links out and tells the stories of organizations doing great things. And finally, we are also aiming to provide internal education, resources, training, etc., to our community, CPHA members, and board regarding how they can operationalize principles of health equity in their daily work and lives. So for the next few minutes, I'm going to provide you a little bit of context into each of these areas of focus. So for the health equity webinar topics, as Jason mentioned, at Public Health in the Rockies in August, we did a little bit of a poll to see what topics would be of most interest. And here are some of those topics. So today we are fulfilling on fostering partnerships and collaboration for health equity. And in the future, we'll be leveraging CPHA and local thought leaders to cover off on how to advocate for health in all policies, how to understand upstream strategies for advancing health equity, understanding critical race theory and other theoretical frameworks, and also, of course, data, how we can leverage data to advance health equity. So look out for invitations monthly for these webinars. And if you are interested in becoming a speaker for a webinar, we are looking for speakers for the latter half of 2019. So please contact Jason, myself, or Marissa Westbrook with your idea. Moving on into CPHA Connect events. One of them that we are working on coordinating for the early part of 2019 will be an event in collaboration with the Center for Health Progress. Perhaps you're aware, earlier this year they released a beautiful graphic novel called Waiting for Health Equity. And the event that we're looking to put together will be about 2 hours, and it will be an interactive session with trained facilitators. So keep an eye out for that event coming up in Q1. Also, in the spirit of access and inclusivity, CPHA board is looking to make the events on the road so that they are not just in Denver and that they are around the state. So we hope to do that in the future, but we believe this first one, or this one with the Center for Health Progress, will be in Denver. And then in terms of resources, as an initial step into developing a resource, we wanted to take stock of organizations in the area and around the state that are doing great work, so that we can actually complement what they are doing and shine a light on them. So in the last few months, we created this living and breathing Google spreadsheet around the first column is around the various, causes, if you will. And then we have the columns moving over the organizations that actually address these causes and that also have resources and education. So over the next few minutes, I actually would love to just shine a light on some partners that are doing some great things because they have created a lot that we can all learn from. So I just wanted to take a couple of moments. If you are looking for, some 101 type of content on health equity, the Colorado Department of Public Health and Environment is one of the best resources for locally. They have a Colorado Equity Action Guide. They have some resources around checking your assumptions. You're not inadvertently hurting the population that you're looking to help. Additional resources around designing programs and how to effectively evaluate those programs, how to frame data, how to measure performance, how to hire for equity and inclusion. And they also have a resource around where you can potentially obtain grants if you are looking to address health disparities in the community. So certainly one of the best resources we have available is the Office of Public Health and Environment. Along with that, they also have a really awesome once a month email newsletter called Change the Story. Webb Brown is, from what I've seen, the author of many of these newsletters, and I've been personally very impressed with the thoughtfulness of the content. Most recently, one of them was around white privilege and about how to talk to your friends who are white about white privilege and how to kind of navigate that conversation, which is, I find, really helpful. So definitely sign up for their Change the Story email newsletter, and I think that you'll be blown away by the content. Just one more shout out to them. This was another one that they included recently, was around language justice. If you are, look to provide language justice in terms of being an inclusive environment where, anyone can participate, they provide this really awesome sort of spectrum on how you can identify where your organization currently sits and how you can improve. So I thought this was really awesome. And let me know if you would like me to forward this to you. I'd be happy to do so. Moving on to a couple of more organizations. Metro Denver Partnership for Health. They are a collaboration of public health agencies serving 7 counties in the Denver metro area. I have them listed here. And they have these 4 pillars of focus around data sharing, behavioral and mental health, healthy eating, active living, and partner alignment. So if you are in one of these 7 counties in Denver and work for an organization related to public health, your organization may be a part of this partnership, and it's definitely worth looking into because then you will have access to all of these resources. Also, the Center for Health Progress is a local nonprofit organization with a mission to create opportunities and eliminate barriers for health equity for all Coloradans. And so they have a lot of awesome content. They mentioned their Waiting for Health Equity Guide helps break down why health disparities exist and what we can do about them. Again, so these organizations are all local, and I apologize that, I'm not going to do them justice today, but wanted to shine a light on them so that people in this webinar and who will be viewing this webinar afterwards are aware of them. Live Well Colorado is a nonprofit that has the mission of reducing obesity and promoting health nutrition in Colorado. So they have lots of programs and partnerships around this, including funding opportunities. They have a Colorado Food Systems Hub, a farm to school resource program, and other alike resources related to healthy eating and active living for Coloradans. Another organization, there's just 2 left. This one is Interfaith Alliance of Colorado. I was very elated to hear that this one existed because they bring together people of various faiths and traditions and backgrounds who have shared values to engage in collaborative action to dismantle systemic oppression. And so these are their 3 sort of pillars around advocacy and action. They track legislation and provide testimony for different initiatives. They have very events to educate and empower their members, and also are very action oriented in terms of in the community. And one of them that's been really awesome to see is a tiny home village that has popped up to help support our homeless population to get back on their feet while providing them a safe place to lay their head at night. So really thrilled that interfaith exists in our community. And the last one that I was going to highlight is Colorado 211 is a database of sorts. You can see across the screen all the various areas that they touch on. And so if you're looking for assistance in one of these areas, Colorado 211 is a fabulous resource. So in the future, we will be highlighting more of this on the Colorado Public Health website. And if you are interested in being involved in this work group, please let myself or Jason know. And without further ado, we'll hand it over to Sedona Allen from our Community Outreach and Engagement Work Group.
Hi everyone. Oh my gosh, this webinar is like off the hook. I'm loving all of the speakers, and I just appreciate all of the great work you all are doing. I am one of the leads of the Community Outreach and Engagement Work Group, and I'm also a youth advisor at CPHA. I would like to just start out by reading a quote by Joanna Macy that I think shines a lot of light on, what this work group is about and really what this webinar is also hoping to do. Cultural shifts happen on a different level. They come into view only when we step back enough to see a bigger picture changing over time. A newspaper photograph viewed through a magnifying glass only appears as tiny dots. When it seems as if our lives and choices are like those dots, it can be difficult to recognize their contribution to a bigger picture of change. So really what we are doing is drawing that bigger picture and really elevating all of the amazing work that is happening across the state. I think, there are so many initiatives and programs happening, and it's like we are coming together as a coalition to really elevate that and show that we have this collective power. Next slide, please. So it's also really like recognizing that each of us has individual strengths, but how can we really come together and uplift what we're all doing. So some areas of opportunity and needs that we have identified as a community engagement outreach group is that there isn't really a database or coordination of existing efforts. So that's why it's so amazing that Lynn was able to compile all of these amazing resources and databases and research that do show that, we are on a path of coordinating and connecting what we're doing so that we can really make a larger impact. We need to diversify some of the composition in the fields. So really looking towards getting people from all areas engaged, including rural areas, and making sure that we have, different levels of expertise that are being brought to the table. So we're really focusing on getting people who are directly in the community involved, but also like policymakers and people who are, in different organizations and doing different work, so we can really have, this level of people coming together to make an impact where they can. We are building the field's health equity policy advocacy capacity by really having an outlet to be able to advocate for policy change. There's a need for more strategic collaboration opportunities. So this is why—
May I interject?
Yeah.
This is Jason again. I just wanted to mention that a lot of these areas of opportunity and needs, in addition to contributions from our membership, but these were determined by an environmental scan conducted by the Colorado Trust, which is a equity foundation, and they have a health equity cohort of 200 plus entities, and they came and presented to the coalition early on some of their findings. Their report is available online, but a lot of these needs have been were identified within their report. And essentially, there's a lack of common language. There's no central hub or centrifugal force which coordinates the efforts, right? So what we found out was, all right, so we all want to do health equity. Turns out there's a lot of entities that are doing health equity across the state. So how can we identify what's the the needs that are not being met, and how can we bolster or amplify existing efforts. Essentially, where can we be the amplifier, and when should we be the guitar, or when should we be the DJ, and when should we be the MC. Additionally, Nancy Lorenzen, who's one of our terrific members, she is a professor at the University of Denver and a member of the iRise 2.0 program they have there, which is a research incubator, is partnering with Jessica Forsyth and Indira Gujal, both from the Denver Metro Partnership for Health. And they're going to be exploring, they're going to take on the work of conducting an environmental scan statewide to really expand this assessment above and beyond the work of what the folks that are involved in the trust to further identify what's currently happening and how we might fit in. Thank you.
Yes, thank you for giving that background, Jason. But yeah, I think this is really a step in creating grounding to really uprise and make a larger impact across the state. Oh, next slide, please. Well, so really this work group is focused on finding intentional ways to engage and include community members from all different backgrounds and who have really diverse experiences. And to do so, we have to create a safe and open place for community members to come and voice their needs and concerns. And we really want this to lead to, the support, the engagement, and the amplification of not only community-led initiatives, but also youth-led initiatives, and seeing how we can bring young people to the table in innovative ways and really, look at how they are being affected by a lot of these issues and how they can be the change makers of this next generation that is going to come and create paradigm shifts in the way that we are doing health equity and public health work. We are assisting in planning and supporting community gatherings and conferences, such as the 2018 White Privilege Summit, Public Health in the Rockies, Culture of Data, and the upcoming Shared Risk and Protected Factor Conference. A lot of these have a strong focus on equity, and I think we have a lot of capacity to just come to the table and bring this amazing work that we're all doing to show how we can really make connections and do this work in a different way. We want to support and advance health equity advocacy efforts in communities and organizations across Colorado. And by doing that, like Jason said, is really creating that grounding and doing a statewide environmental scan to determine our current state and really identify priorities that will resonate with, health equity in communities and what are the community's needs. It's not us deciding how to move forward and what action plans to do, but it's really us elevating the voices and the expertise of our community members who are directly affected, by all of this. And we all play a part in that, because we are all part of community. So it's how can we, create this collective voice and gain power in that way. Next slide. So what we've been doing is really, we don't start with, jumping into the work by, having, let's have all of these ideas and go into it. We've been very strategic, and a lot of that has to do with relationship building and creating trust within not only our work group, but within community. So we have done some activities to define what authentic community engagement means to us. So some of these things include truth, honesty, transparency, being genuine and rooted in one's experience, having a holistic approach, recognizing that our intentions aren't always the same as the impact. So how can we really look towards what impact are we making? Having integrity, open-mindedness, and being very community-driven. And as Jason said earlier, when should we be the amplifier and when should we be the guitar? So recognizing this superhero versus sidekick relationships and really coming together as a partnership. So it's not, this group that's trying to, make all the decisions and tokenize community, but it's really partnering with them and creating this shared space where we can empower one another. And really having this authentic engagement where we can connect and be action-based, like Jason said earlier, be inclusive and have understanding. And I think a great way to do this is by, having gratitude and showing the strengths and the successes that different entities have been cultivating so far. And as Maya Angelou says, you can't use up creativity. The more you use, the more you have. So I think, we just keep bringing this creativity and this energy to the table, and it'll just keep having this amazing ripple effect. Next slide, please. I'm going to hand it back over to Jason real quick to talk about FLTI and the amazing work that they're doing.
Right, so one of the identified areas of opportunity and need, as stated earlier, was we need to elevate marginalized voices and perspectives and ensure that the people we wish to impact are at the table and represented. And one way we've been intentional about this is through inclusion of a lot of folks who have been involved with the Family Leadership Training Institute, or FLTI. One of our work group leads for this group is Taylor McKinney, and she's the site coordinator in Sheridan. I actually went through this program myself in Arapahoe Douglas in 2013, and I'm currently the facilitator in 5 Points and Montbello. But I really believe that we can't make the sweeping changes we wish to achieve through the professionalization of social justice. We need civic and voter engagement and the ABCs of agency, belonging, and changing the conditions. And we need community engagement to achieve that. And FLTI equips family and community leaders with civic knowledge and leadership skills to support their engagement with systems at the individual, community, and policy levels. I'm not going to get too much into depth about the program. I encourage you all to explore it further. We have 15, it's a national program, but we have 15 sites across the state. There's over 1,200 alumni. And we have language justice. We spend a day at the Capitol where we demystify the democratic process, and folks get to meet their legislators, observe proceedings, and attend committee hearings. And each participant develops their own civic project out of their own passion, and that network of alumni support the completion of those projects. The next round of trainings will be in January. I should also mention that it is a 28-year-old curriculum. And there have been conversations and a lot of work underway at both the national and the state level around adapting and reconstructing the entire curriculum to make it more health equity and racial justice oriented, as well as provide training opportunities in these arenas for new and existing facilitators. Actually, on Monday, I was part of another webinar where we were speaking to the importance of, these conversations around race and racial justice are uncomfortable. There's been a little bit of resistance among new participants and facilitators, not resistance as much as just lack of understanding and awareness. And FLTI is really a space where people from, you have classes between 15 and 30 folks from various ethnic and cultural backgrounds coming together for the sole purpose of making positive change in the communities. And it's really the only platform that I'm aware of where folks come together every week and engage in these types of dialogues in a healthy and productive fashion. Can't say enough about it, but I'll stop there. If you're interested in learning more, feel free to reach out to me or Taylor. Next slide, please.
Thank you, Jason. So some action items and next steps that we have identified is, going forth with this statewide environmental scan to determine our priorities, breaking off into smaller work groups within the community outreach and engagement group. So we are, kind of determining what that looks like and being strategic and really elevating, how can we have these subgroups that can do individual work, but then come together at times to see, where we're at and really support one another and create that larger impact. Next slide. So some updates and successes was a recent health equity training that myself and Angel Smith from CPHA facilitated. And it started with convening the Council of All Beings, which is framing health equity in a whole new, unique kind of way, where it's not only looking at equity in the sense of human beings, but it's going forth and looking at it on an environmental level and an ecological level. So seeing how all beings are being oppressed in some way. So what this this activity looked like is, doing different activities together, like meditations and connecting with a being that that the young people would then bring forth and embody and represent during this council, and just really speak on their behalf. So it's showing, how we can show up and advocate for others and recognize this oppression on all levels. And it was just very powerful. And that led us into an actual health equity training where they gained a common language and understanding of, health equity versus equality. And we really discussed Frantz Fanon's critical race theory and other theories that really frame health equity and social justice in a way that resonates with young people and can really get them activated and empowered to go forth and do this work. So we had over 20 young people in attendance, and they all got certified as a health equity advocate. So they were very inspired after this meeting. So as the next steps with this group, we will be meeting this Friday to see how these young people can determine some kind of project that we can launch through the community engagement and outreach work group, and really show their strengths and, bring this creative voice to the table. So I'm very excited to see what that will look like. And I'm just very happy that Jason is such a huge supporter of this, and that we have, a strong group overall that is really amazing, and just helping in so many ways. Next slide. So lastly, I want to share a quote by Angela Davis. You have to act as if it were possible to radically transform the world, and you have to do it all the time. And before we jump into Q&A, I would like to do something radical with you all that we don't usually see on webinars. So if everyone could unmute themselves really quickly. So is that possible? Cool, so everyone unmute themselves. And what I really mentioned earlier is that we are a collective unit, but we all have our individual strengths. So I want to do an activity. I'm going to say I am, and everyone is going to say strong. And then I'm going to say we are, and then everyone's going to say powerful. And we'll do it 4 times to just amplify this fact of our strengths and collective power. Is everyone ready?
Yes. Sure.
All right. I am
Strong.
We are
Powerful.
Powerful.
I am
Strong.
Strong.
We are
Powerful.
I am
Strong.
Strong.
We are
Powerful.
Powerful.
Oh, yes. Thank you so much, everyone. And, I hope you took a lot from this webinar and are inspired to go forth and implement health equity in your own work and get involved in the CPHA Health Equity Coalition and possibly a work group if you are interested. So I hope you all have a wonderful day.
Wonderful. Thank you, Sedona. Really appreciate it. And thank you to all our work group leads for being willing to talk about the work that they're collectively doing with their work groups. Again, I hope this has been really obvious that it's a collective effort throughout the entire coalition, but also from others who've contributed along the way. And so as much as I could keep up with it, I tried to paste some resources that people were mentioning into the chat box, as well as contact information. So if you're looking to reach out, you can feel free to scroll through the chat box and see if there's anything maybe a resource for you or someone's contact information you're looking for. So I want to go ahead and open it up to Q&A. We had one question from the chat box that I was hoping, Lynn, you would have a second to answer. So the first question is, what qualifies a program or organization to get on the list of those doing great work? And can you talk about how that was determined and how that project's going to continue to move forward as well?
Yeah, sure, no problem. So it is absolutely an evolving resource. And so just in our initial sort of take on it, we just included some of the maybe larger organizations or organizations with a lot of resources related to health equity, especially resources that were a little bit more kind of 101, if you will. But we are happy to include any and all organizations in Colorado that are doing health equity work, especially if you have external facing resources that someone who can just basically go to your website and find those resources. We can definitely highlight resources and organizations that have resources that are sort of behind a login, if you will. But it's, you know, it's awesome when someone can actually click through and see it without logging into something, obviously. So we don't really have any restrictions at the moment. And if you would like to be included, that would be awesome. Please just send me an email to my name. It's lynn.coves, Koves, @gmail.com.
Great, thank
And
you.
I'd like to add to that and sharing a little bit of the context. As Lynn mentioned earlier, one of the goals of this work group is to create a platform where we aren't, because it's easy to become bogged down and almost feel demoralized when we fixate on everything that's going wrong and all the problems within our communities and society as a whole. We wanted to highlight, here are the people that are doing it. And, you know, here are the resources that are available, here are the successes, and here are the folks who are in the work, and create a positive platform. And it's still expanding and growing, but yeah, we need help. If there's folks we're missing, please contact Lynn so we can make this list of resources as big as possible.
Wonderful, thank you. Still open to any Q&A, so if anyone from the audience would like to unmute themselves, and feel free and ask a question to one of our speakers or to the work group's leads in general, feel free. And if there aren't any questions, if there's also feedback or things you'd like to see these work groups move towards, things that you were thinking about as they were going that could contribute to the larger work group effort, especially if you're not involved, we would love to hear your feedback.
This is Rita Beam. Can you hear me?
Yes, thank you, Rita. Go ahead.
One question that I have is, and I'm a retired public health nurse from Tri-County and work basically in kind of community consulting when asked. But one thing that I'm finding is a gap that I'm not sure, I don't know that I have solutions as to how we address it, but for those individuals in our communities, regardless of their color, that because of their economic status do not have the ability to find legal help when they're faced with difficult situations, whether it's related to, financial help with, like family issues and et cetera. That's one thing that I'm seeing in our community that is an issue. And so I thought maybe you want to put it on a parking lot list.
Thank you for that. And, one of the challenges of a multiracial cross-sector coalition so oftentimes like a coalition, you have folks that are engaged in a relatively narrow sector or area of focus. And oftentimes these coalitions are time limited. But when we're dealing with health equity, it's so broad, right? And there are so many components and facets of equity. So one of the challenges is how do we bring people to the table and keep them at the table? And because that is a tremendous issue. And all said, I welcome you to join us, and it's a question that we can explore together. We're still, sorry?
Oh, Jason, it's David. I just wanted to add, there is a group out there that focuses specifically on those issues, although the work is still upcoming. It's called the Medical Legal Partnership, and Chris Bowie from Denver Public Health sort of leads it. It might not be bad to have him present on that particular question here on the webinars.
He's actually right down the hall. I was thinking that myself. Yeah, I'll reach out to him. Thanks, David.
That would be helpful. Thanks.
Mhm.
So if there are no further questions or feedback at the moment, I just want to urge you, again, if you're not currently involved in our organization, in the coalition, we really urge you to reach out to one of the work group leads you heard from today, reach out to Jason, and find a way to get involved, even if that's just suggesting a webinar presenter that you feel like speaks to some of these issues. If you have skills that you feel like might contribute to this effort, or just like to be more involved and like to know more, we're happy to loop you in and get you involved. And so we hope that you'll join us in our efforts. I also wanted to open it up to any other announcements. We had one announcement from Paul, if you'd like to go ahead and make your announcement.
Sure. Can everybody hear me?
Yeah, go ahead.
Great, thanks. First of all, it's really been a pleasure. This is the second time I've met with you all. I appreciate the opportunity to be involved. I have not jumped in with both feet because I'm in the midst of building our health equity practice here at the Denver Department of Public Health and Environment. We've just been designated officially as the Office of Health Equity, and we'll be working with other departments in the city to bring health equity into all the city work. So again, my thanks for letting me be involved and your understanding about why I may not be as involved as I might want to be. Just wanted to let everybody know, many of you may be aware of the Redesigning the Red Line exhibit in Denver that Enterprise Community Development has brought. What you may not be aware of is that on December 19th, there's going to be a meeting of organizations interested in the intersection of health equity and housing that's associated with that exhibit. So I'm wondering if I could get the flyer to Jason or someone, Marissa or someone else, if you could get that distributed to the whole group so that people might register if they're interested in being part of that meeting.
Absolutely. And I would say in general, if anyone ever has announcements that fit within the Health Equity Coalition goals and aspirations, to forward that on to Jason, myself, to Lynn, anyone like that, and we'll make sure to get that out to folks. So this really is also an opportunity to share what everyone's doing and have us all sort of learn from that experience together. Thank you.
I know we're at time, but I'd like to close with a brief, just a brief statement. I want to shout out some folks who have been very instrumental in building this, the Health Equity Steering Committee, Sharif, Abdelhamid, Marisa Vasquez, Wavina Gongo, Stephanie Salazar Rodriguez, Taylor McKinney, Ashley Wheeler Bell, Madeline Morrissey, Kenneth Scott, and Suzuko Shimasaki. People that know me have heard me say that I set out long ago to be more than an angry man in a bar. And I didn't have a sophisticated understanding of what being a change agent or a helper was going to be. I went to the Graduate School of Social Work at the University of Denver to try to figure that out. And I was sitting in class probably just a few weeks shy of graduation, and I was becoming rather frustrated because I was hoping that the exorbitant amount of debt that I was incurring, in addition to affording me with a master's degree, would also give me a very clear understanding and roadmap for what I was supposed to be doing with my life and where I was supposed to go next. And I was sitting in class, and I had an epiphany that there would be no epiphany. And I think it was all over my face as I was leaving the classroom, and my professor pulled me aside and asked me if I was okay. And she asked me in a way that meant that indicated she really wanted to know. So I said, no, actually not. And I explained pretty much what I just said. And she smiled knowingly and responded. She said, may I offer you some advice? I said, yeah. She said, I think what you ought to do is just choose your horizon and march. Choose your horizon and march, and commit to right action every step of the way. And I assure you that that will be hard enough. And those words have stayed with me. And turns out she was right. But I have to say that going on my way and meeting others, marching toward the same horizon, has made the journey much, much more rewarding. And in this work, like I said, it's so easy to become demoralized, but this coalition has really held me up, and we try to hold each other up. And we're marching arm in arm toward the same horizon. We might not get there in this lifetime because it is the horizon, but I've enjoyed marching alongside the other coalition members, and encourage all of you who are interested to join us.